Hello, everyone. This is Dan Toner, the health insurance agent and broker from FFP. I'm here to talk about some changes going on July 1 with the K&E health plans. Traditionally, we've had an April renewal, but we're going to improve some benefits, and we're going to kick off with a open enrollment at some point mid-May and last that for about a week or two, and then we're going to transition to a couple of different carriers. On the screen, I'm showing a new memo we put together that will provide for new hires, and this kit will be provided to you every year moving forward. On the bottom of page 2, just some of the highlights. We're going to be changing our coverage from Blue Cross Blue Shield Horizon for medical and vision. We're going to remain with Delta Dental. On the next page, you'll see a kind of a quick summary, but there are detailed SBCs. So these are hyperlinks, to launch the full summary of benefits for each plan. Keep in mind, one of the reasons we're going to United is, number one, lower costs for you. We're able to get a plan based on your health, and you guys are pretty healthy, so that should be better than Blue Cross Blue Shield. Number two, all 4 plans are nationwide. You don't have to offer plans that have the blue card or not blue card. Horizon was New Jersey only, and you had to have buy a blue card to move off of New Jersey's network. You don't have to do that with United and Oxford. Oxford is your carrier. They're owned by United Healthcare. And the way that they work is all 4 plans are nationwide. You have access to Oxford Freedom, that's the largest network in New York and New Jersey, and then United Healthcare's Choice Plus anywhere outside New York and New Jersey. That makes it a national plan, whereas I just mentioned before, Horizon was more of a local carrier. All 4 plans are pretty unique in that you'll notice your doctor copays, your specialist copays are the same on all 4 plans. X-ray and lab is 100% coverage on all 4 plans. Urgent care center is a copay on all plans, and the prescriptions are generic and name brand. Some of the pharmacy programs with Horizon, for example, the silver was 50-50 coverage after a deductible. Those on a gold had a $250 deductible before the copays. There's no deductible for prescriptions, and all the same 10 for generic, 35 or 75 for name brand. So what's unique about United is all those things I just mentioned are all the same. The difference between the 4 plans is primarily the first 3. The difference is how you want your hospitals, surgeries, and MRIs, called imaging, to happen. The first plan is your lowest premium. You have a $6,000 deductible for hospital surgeries and MRIs. Then you owe 30%, but you'll never pay more than $8,150. Your out-of-pocket was $9,450 with Horizon. So this is a better out-of-pocket, but it's for a higher deductible for those that don't anticipate going for hospital surgeries or MRIs. The next plan is a little richer in coverage, a little higher in price, because you'll take those hospital surgeries and MRIs. You owe $1,500 in a deductible plus 20% of the bill, but you'll never spend more than $5,000, significantly less than the out-of-pocket with Horizon. Third plan is, well, maybe you don't want to owe that 20% up to $5,000, so there's a zero coinsurance. United bumps the deductible up to $2,500, so your hospital, surgery, and MRI, you owe the first $2,500, but then nothing. And you'll see zero after deductible, zero after deductible, zero after deductible for MRIs, CAT scan, PET scans, radiology. So a little bit richer than this plan, and that's an option. The last plan is a PPO. It has both in and out of network coverage. It has a $1,000 hospital surgery and MRI deductible, and then you owe nothing afterwards. So sort of giving you 4 different plans with a range of coverage. All of these are significantly lower in premium for many of you. Horizon charges you based on age. United and Oxford are charging the same rate for all your employees. So that should be pretty good news for most of you. Moving on, when we enroll you, you'll get a member ID. You'll go to My UHC and sign in and register. This is how you can look up your doctors. Remember, New York and New Jersey, it's the Oxford Freedom Network. And outside New York and New Jersey, it's the Choice Plus. This is how you can look at it. They have some tools and resources that you should take advantage of, and all the programs they give you as a member. When you log in and create your account, you'll be able to see a lot of those tools and resources. As mentioned before, we're going to remain with Delta Dental. This is just a description of the dental plan, how to look up dentists, and this is your existing plan. If you have any questions, please let me know. We are going to ask Delta to move the April renewal to July 1. So this way next year, we have a full July renewal for all of our products. We're going to change the vision. Nothing's wrong with you with the Horizon Vision plan. Davis Vision is not the largest network in the country, but it's a good plan. It renews in December. We thought, since we're moving medical, let's give United a try. So we're going to use the Vision plan from United. Here's a copy of it. It's actually a little richer in coverage with your frequencies of how often you can get reimbursement for lenses, frames, and contacts. And the higher you have, a higher reimbursement cash plus a discount. So take a look at the summary. Let me know if you have any questions. On the My UHC site, there's a button say look up vision providers. Okay. How to enroll. You guys are familiar with our selection sheet. At the bottom of each one, you'll check I'm a single, couple, family, or I want to waive, and you'll sign and date. You'll get that to Annette over in Human Resources. And here's the copy of it. So you can print this, or it'll be provided to you separately. There's a sheet. You'll write your name in, and you can see the 4 plans. And here's the good news with costs, right? So these should be a lot lower for many of you compared to the Horizon. Delta, we're already renewed in April. Again, we're going to try to move that to July. If anybody's new to dental, let me know. Otherwise, your plan will just renew from what you chose back in April. And the last is a vision. So this is important because it's a new product. So make your election on vision. There's some employee notices here about the fact that we have any deductions are coming out pre-tax under Section 125. So there's a notice, COBRA notices, there's sort of annual notices that we need to send to you. There's a contact page for both Oxford United Customer Service, their website, and Delta. And then my team, you know me, Dan Toner, and there's Amanda and Leslie that support. So any questions, let me know. And we're going to try to do open enrollment. We're going to start it on the 15th. We're going to try to end it on Friday, the 24th. If we need a couple of days, that's fine. But this is not the first time we're doing this. My team really has to take information that last week of May and send it off to start the new plan. If you're getting this during the year, that means you're a new hire. You have a 90-day waiting period, as the memo indicated. Sometime in the second month of employment, you'll be given this notice, and then you'll work with my team to enroll you and get you covered after the 90th day, enroll or waive. Wish you guys a great day, and thanks for everything.